Good morning and welcome everyone. Everyone here in Litteraturhus in Bergen and everyone who's attending online. And today we pick on from the first day of this conference on the ethics of pandemics, lessons learned in the Nordic countries. So yesterday we had 5 speakers, all adding a piece to the puzzle of if there's lessons that we might have learned about the pandemic, not yet in hindsight, but after our first waves at least. And we had speakers from all the Nordic countries, from Finland, Norway, Denmark, and Iceland. And today we will sort of add a few perspectives and a few voices that were perhaps not so much heard yesterday. So we'll have more focus on conversations with stakeholders and with policymakers and see if there are things that we can add to the bigger pictures, and more of a focus on conversations and see if we can get some nuggets in terms of lessons to be learned from that. Moderating today will be Hilde Sandvik, who is a freelance research journalist and also running a podcast on. So, You can tell me later. Yes, so I'm not going to keep you for very much longer. Yesterday we ran a bit over time, but the focus today will be to sort of pick up on some of the topics, add some new perspectives, and see if we can have some interesting conversations and see where that will take us. So some of the topics that came up yesterday were, have we forgotten all about global solidarity? Is there someone speaking up for the vulnerable? How should we think about truth-telling? Is there a point to admitting that mistakes will be made early on in a pandemic when we don't know so much? We also heard about an Icelandic troika of experts giving information and all kinds of other things. I'm sure everyone picked up something else, something different. But with that, we have a packed program for today as well. So I'll hand over the floor. Yes, the floor. Thank you. And the screen to Hilde Sandvik. Thanks very much.
Thank you very much. Probably the reason why I'm here now is that I'm running the podcast, which is also a radio program in Norway, Sweden, and Denmark. So it is on NRK. Swedish radio and Danish radio, and it's called Norsken, Svensken, or Dansken. So that's probably why I'm here, because we started out, I'm sorry just to say this, because we started on the first program was actually out on the 16th of March 2020. So you could all imagine that the talk we had every week was about what happened in Scandinavia, not all Nordics, but in Scandinavia. So that's kind of my background for being here right now, I think. I'm really looking forward to bringing up two good panels. And I will also say that by the end of today, we will have a question time, as you have in the Parliament, where the speakers from yesterday can come up and ask questions to the panelists who are physical here. So that is also something I'm looking forward to. So please just write down questions to what will happen here now. The first panel will be it's bringing up politicians, policymakers, stakeholders, health authority together. And of course there were some questions during the pandemics whether or not the politicians should be in the foreseat or the experts. And I think we will dive into that problematic kind of realm in the next conversation. We'll also talk about what happened on the national level, Nordic level, but also on the local level. So I'm very happy to introduce Beate Husa. You can come up here, Beate. Commissioner for Elderly Health and Voluntary Sector in Bergen Kommune, Bergen Municipality. We have Mika Salminen, Director at National Institute for Health and Welfare in Finland. Welcome, Mika. Welcome to Bergen. I live in Bergen, so I feel this is kind of, we can say hello, Beate, can't we? Yeah. And then with us on screen is Frode Forland, Director, Norwegian Institute of Public Health. Hi, Frode. We can't. There's no sound here now, I think.
Hello.
Yeah, now you're here.
Yes. Good morning from Oslo.
Yeah.
Hi.
Good morning. Lovely to have you here, of course. And
Thank you.
I have to admit that I found it always very funny whenever you were called the Anders Tegnell of Norway, whenever you were in dispute in the Swedish media. I'm not sure whether you're fed up listening to that or hearing about that, but I found it funny, I have to admit.
Yeah, well, I've had to state every time we don't have a state epidemiologist in Norway, but I've had some of the same roles as Anders Tegnell, and he's still my good colleague. Thank you.
But we all know what kind of figure Anders Tegnell was in the public, so in Sweden. So it's still a little bit funny, I think. But I will first move to Finland because since we're standing here as Norwegians, and to be polite, we will now talk about how was the cooperation. What was the differences between us, and where did we meet where was it, where are the obstacles in a way, and also to think of the next half hour as a live think tank. So Finland, can you just start giving us this little brief picture?
Sure. So maybe I'll just clarify my role during the pandemic also. So if Frode was Anders Tegnell in Norway, I was the same in Finland. Yeah. And Frode is a good buddy of me too. We actually worked together at the ECDC many years back, but that's another story.
Because you all three, you know each other.
We know each other very well.
Yeah, you've been talking quite a lot. Yeah.
Sure. So, let me maybe start with that. When the pandemic started and us professionals started looking at this, one of the major disappointments to me personally was that there was so little proper coordination across the Nordic countries. There was constant information flow, and we talked with Frode and we talked with Anders and Torofur from Iceland and several people from Denmark on a bi-weekly basis, basically throughout the pandemic, about technical issues and also policy issues. But of course, we are not the decision makers. And I sat with the government at least in 100 sessions, and I asked my colleagues, why are you not talking to the other Nordic countries, and why are we not trying to coordinate the actions more? But I didn't really get any good answers, to be honest. That was very surprising. It's a very big contrast to what's happening now with Ukraine, where the whole of Europe came together pretty much with one voice, and certainly the Nordic countries, not to speak about how Finland and Sweden are now going side by side into NATO. I didn't.
We need to stay together now.
Yeah.
That's
I didn't see that in the pandemic beginning. This was very difficult actually, because from my perspective, Nordic cooperation is kind of bedrock. It was there before the EU, and then it kind of failed here. So, over time, of course, there was discussion. I'm not saying that, but the policies on just across the borders. Let's take the example of Åland or the example of Tornedalen, where there were totally different approaches across the border, and also suddenly a border which had not existed for a couple of 100 years. So this was quite traumatic, I think, for many people, and certainly even for the professionals.
Actually, I had the Swedish ambassador on stage together with also the Finnish and the Danish and the Norwegian minister, talking a little bit also about this. And it was actually about defense policies, and politics. But then she said, the Swedish ambassador in Norway, she said that if this is going to happen one more time, we can't stand it. It was so dramatic that the Swedes were still traumatized by this feeling of meeting up with a closed border. But this is, Frode, again, I mean, you are the experts here, and how the politicians kind of moved after what you were telling them was very different in the Nordics. And you've said that in Sweden, the experts were too much in front.
Yeah, I think the politicians, they listened to the experts in their countries. And the experts were actually talking together for the whole time. And we've continued to talk together from the beginning of the pandemic until now. We still meet, not on a bi-weekly basis now, but a monthly basis. And the Swedish policies here, they were actually outliers in the Nordic setting.
Yeah.
Sure. And we agreed until a certain point, and then they had an other strategic move that was mostly against the rest of the world, I would say. And that's where Finland, Denmark, and Norway, and even Iceland, more or less took the same approach. And Sweden decided to listen to their experts at the Institute of Public Health, which was much more to open up and to keep the society going and not impose strict regulations in the first phase of the pandemic. And I think also it was much more of a monolithic kind of decision-making culture in Sweden than in the other countries where the politicians came on board much earlier.
Yeah.
And I commend the Norwegian government for doing so, because this was not only a health matter, it was not only a public health matter, it was a matter of the whole society, calling upon the government to really go in and also take the drastic decisions that were taken in Norway on the 12th of March.
But what do you think? What is the reason why Mika now says that to sit down and talk with politicians and also telling them to talk with their neighbors? And he didn't feel that he got response on that. Why do you think that could happen?
No, I think the politicians in Sweden, they were actually very much afraid of intervening with the professional matters. That is the tradition of Sweden.
Yeah.
I think in Norway we have this triangulation of power with the Public Health Institute, the Directorate of Health, and the government. So there was always even a discussion within our country, what is the right policy to choose? And in Finland, the Public Health Institute and the Directorate is in one organization, but still you leave a lot of power to the politicians. And in Denmark, I would say the same. They were always ahead, I think, both of Sweden and both of Finland and Norway, also when it comes to taking political actions.
Denmark had a commander-in-chief in Parliament. That was also the case. I mean, she rose to the occasion, we could say. Hope I'm not now offending any Danes here. But Beate, you were sitting here, Bergen municipality, and how did you? I mean, first starts with how did you, as from a politician's side, see what happened in the Nordics to start there on the national level and the Nordic level between the experts and the politicians?
I think when we looked at Sweden, we were quite we agreed that was not the approach we should choose in Norway. So we were happy that the Norwegian experts didn't advise in that direction. But in Bergen, in the beginning of the pandemic, we had our first case 28th of February. Our local experts here, they were expecting more action from the national authorities. And I was also in direct contact with my party leader, who was then a minister in the government, because we felt that the feeling of crisis were not so... we felt the crisis more than we felt that the national government felt it, if we could put it that way. And we just do something. So we were quite impatient, and we also felt that the public was quite impatient. Now something has to happen, and I felt that Sometimes in the pandemic, I felt that Denmark did choose, the right approach, and Norway came a bit after, and maybe the waves were a bit different too, but we looked a lot to Denmark and were inspired by Denmark and the way they handled the pandemic.
Mika, how did it, I mean, the beginning it was, you described what happened, but how did you feel that the experts and the politicians and this Nordic aspect grew throughout the pandemic?
So, to be clear about this, I also feel that it was important that the politicians were involved relatively early, because, as Frode said, this was not just a health crisis, it was a comprehensive global crisis affecting all parts of society. It's impossible to deal with it as just a health crisis. If you do that, you would do many things wrong. So it was necessary. So, I mean, we did the same. Nobody knew exactly what would happen, or nobody knew exactly what was the right way to address a situation like this, because, to be honest, the plans which were in place before were not built for a situation like this. And I think we're not realistic enough either. They were kind of a little bit too hopeful in a way, and only looking at influenza, which this was not. But over time, we had the benefit of learning from each other, and this would, of course, go beyond the Nordics. But of course, in the Nordics, it's easier because the societies are so similar. So you could more easily implement certain things that we saw that, okay, the Danish are doing this, that looks good. The Norwegians are doing this, that looks good. Iceland is doing this, that looks good. Maybe we shouldn't do some things that they do because it doesn't suit us. So that was very useful. And I think the politicians did the same, actually. They talked then about the measures in various fora that they met in the EU Health Council and the Nordic meetings. So it worked both ways. The Finnish situation was maybe a little bit different from some of the other, I think most of the other Nordic countries. We all have slightly different legislation. And we have a preparedness law, which goes back to the post-war period. And in the previous pandemic, we had put in a scenario to put into place this preparedness law, which is not quite martial law, but it's close, which was a pandemic. So early on, actually on the 16th of March 2020, the president and the government announced that this comes into force. And that gave them much more powers. Normally we have a devolved government, so municipalities are in charge, most things in Finland. But this gave the government the possibility to do sort of concerted efforts that cover the whole country.
Yeah, could I jump into that as well? Because I think the legal basis here has been also part of the startup here. Because in Sweden they were saying they had no legal basis, even from the government, from Löfven to act. This is the role of the Public Health Institute. In Norway we also have the beredskaps, the preparedness law, and we have the infectious disease law, which gives a huge authority to the municipalities. And we've seen that in Norway that the role of the municipalities has been paramount important for handling the pandemic. And Beate has been involved in that from stage one and throughout in a lot of meetings. And we've been having all this kind of interaction also between the national and the local level, which I think has been also very fruitful for understanding the role of being prepared. It is also to be prepared at all levels of society, and both upwards as well, being prepared as an international nation and as a Nordic community, if you will. And there was a lot of political tension, I would say, also created between the Nordic countries in this sense, which was hard to cope with, as you say. And we also had these meetings in the European level, and we met regularly also with the Nordic countries, with the European Centre for Disease Prevention and Control. And in Norway, with a strong level of collaboration, I would say, between the national and the local level, where in Sweden they say The responsibility is with the region.
Yeah.
And even the national level cannot intervene with the region's responsibility. So there's something here which is also making it interesting to reflect upon.
Absolutely, but you again, you've also said that you also saw politicians who got too eager. I mean, one thing is to keep this balance between the experts and the stakeholders, the policymakers and politicians, but sometimes you could also see that politicians moved in too harsh or became too eager.
Was that to me?
Yes.
Sure, yeah. I do agree, and I agree with the comment from the Corona Commission, saying sometimes also the politicians went into really detailed decision making where they should left this with the experts or with the authorities. So I think that sometimes they couldn't really stop because they found it extremely funny to be in power and to deal with how many are allowed to sit in a home or be around a table or visit somebody at a nursing home. So I felt that's a true comment from the Commission. But this is a kind of the quintessence of understanding public health. When is the role and responsibility of the experts starting and stopping, and when starts the responsibility for the politicians?
Sure. Because Beate, Husa, a title, perhaps this is not fair to bring it on the table here, but an article in NRK read, "The city council got over-ignited and sloppy," because you were kind of turned down in a court case where the Bergen municipality tried to find people who were partying more than 5 people in the room. And how was this, I mean, how did you kind of measure all these needs against each other during these months?
We had long and interesting discussions, of course, and of course we understood that this would make a great impact on people's lives, and it was a power. You're not comfortable with having that much power. You feel it on your shoulders, of course, but at the same time we felt a lack of, medical, legal, ethic guidance, because we had our meetings with FHI, I don't remember, and we had good medical guidance, but they said you know the local situation best. So when the media came and what does FHI say and what do you say, and they connected the dots, and here are some differences, but that was not the case. The FHI did give us some advice, but on the medical level, maybe not so much on the ethical level, and definitely not on the legal level. So we felt alone a lot, and but we also felt okay. We need to save lives. That's our motive, and for me. In that situation, of course, there was a huge media battle, but it also led to a lot of attention to the rule, to the regulation we had decided, and people in Bergen were very, very aware that the infection happens in the homes, at the parties. That's not a good place to be if you don't want to get corona, and that attention led to I think that a lot of people in Bergen followed the regulations. So, but of course afterwards we saw that this was maybe too much, and we changed it.
Do you regret anything that you did?
Of course, the rule of only 5 people in the home, that was not the best approach, because we later changed it to you can only have 2 guests, which also is a very strict rule, but then grandparents can visit a family, for example. So, and we got all these, of course, reactions from people, but I think, and we had that rule, the 5-person rule for I think 2 weeks or something, and then we changed it. But of course, the situation, like we saw it, was this is really serious. We need to do something to get things down, and we had seen earlier on that if you are too late to put quite strict regulations in, this comes out of control, and we didn't have enough people to trace the it was so many people working, and we needed so many people, and there were no people, medical people in the market. So the situation, we felt pressure from all sides. Yeah.
Mika, when you hear a politician talking here, feeling lonely in the decision making, sitting here, do you recognize that? Have you heard stories like that?
Yeah, absolutely. I mean, it was very obvious that so for us on the health sector side, it's in a way easier because we have to think about what should we do, where are the risks, and what can we do on a medical and epidemiological side of things. But then, of course, the decision makers, who are the politicians, which is the right way, actually, I think, who then have to translate that advice into action. And we can provide some options, but we cannot estimate all the consequences of, let's say, shutdown of some business or some side of society. That is then up to others. And it's not an easy task.
No.
I can certainly understand that.
And then there is a following up question, because I mean, then there are so many values here. One thing is that you don't want people to die, but you also want people to have good lives. And I mean, did you feel, all three of you, did you have enough steering resources on what values should count, and were there actually clear values to steer by? Do you want to start, Frode, and Mika afterwards?
Yeah, I think that's a very interesting question, of course. And in medicine and in health, we're all having this obligation to save lives first. And of course, that is trying in this situation to avoid infections to spread, but also having very bad psychological health, meaning that children couldn't go to school or couldn't go to kindergartens, could also lead to physical and psychological and mental
and it
illness.
has turned out.
It has done so, definitely. We've seen that in our reports. And of course, I would say there is something here which is left still with the politician, and that is to value the proportionality of the measures compared to the necessity or the usefulness of the measures. And that is having all those kind of values in hand at the same time to see. And of course, sometimes also mental health leads to loss of lives. So I think in some type of settings here, we were maybe too much focused on infectious disease prevention and not on the whole sector of the health and consequences of the measures.
Mika.
Yeah, so I wholeheartedly agree on that. And total government crisis or total global crisis, which goes on for 2 years, cannot be a medical dictatorship. That is not.
Was it?
Really. Well, it was close.
Yeah.
It was close because the life-saving went above the right for children to go to school without interruption, which has a very long-term effect. Maybe we did okay in the Nordic countries where we do have the distance schooling options, maybe a little bit better. But think about countries like the Philippines or many other countries where schools have been closed for 2 years. I mean, that's going to be a
Massive,
humongous development sort of backstep. Vaccination programs, the regular vaccination programs for measles, polio, many other have been scaled back because everything was put on COVID. So that kind of balancing, and I don't have the answer, should have been done, and at least an attempt to estimate what the sort of collateral damage would be from all the measures that we did. We asked the government many times. They did some of it, but very superficial. Of course, it's very difficult to do very quickly. So I was very sorry that I couldn't be here yesterday when you had the ethics discussion. Unfortunately, my plane I had trouble to get out of Ireland yesterday morning, so I had to take a later flight and I missed the discussion. But I'm really hoping that this would be looked at very carefully afterwards, so that you can do the sort of proper estimation. In the beginning, of course, I can understand you have to go the precautionary way, but 2 years, that's a long time.
Because to be fair, Beate, I mean, the life expectancy in the Nordics, except from Sweden, actually went up during the pandemics. So that then it's also, I mean, to ask, did we do too much?
Yes, because now we have problems getting nursing home places for people, because there's a line.
They live too long now.
Yes,
That's
that wasn't there before the pandemic. Just to, about closing schools and kindergartens. In the beginning of the pandemic, we got contacted. A lot of parents said, either you close it or we will hold our children at home. So I think a lot of people were very afraid in the beginning, and I think somehow it was. Of course, it wasn't right. We have seen that, but we also have to take into account that people were very afraid. A lot of parents would have hold their children at home anyway. So, so that's also something to think about. But you asked earlier, did we have the resources to both think of the medical issues, the legal issues, and all the issues we should consider? And of course, Bergen is one of the big municipalities, so we had resources on another level than our neighbors around us. And I have often felt sorry for other politicians in other municipalities, because they listen to the head doctor, the community doctor, and okay, he or she says this, we have to do it. But we had other advisors as well, so we had the possibility to think about it. And also the media wanted documentation on everything we did, so we needed to address everything in our decisions. But so when Frode says the municipalities had an important role, I think in the evaluation we have to do, we also have to think about the difference between the size of the municipalities. But also, of course, in Bergen, we should have done more. We should have used more time, but we felt we didn't have the time. So we couldn't document everything we talked about. But of course, one example is we didn't, when we had high levels of infection cases, we didn't close down restaurants. That's an example. And we had a long discussion because we wanted people to be able to meet each other, because we thought that was very important to prevent people being lonely. So that we had a different approach than the national government had.
We have only a couple of minutes left, and I just want to ask Frode, because one of the things that I mean, since I was working with this podcast for the 2 years, I followed closely the media coverage in all the three countries, Norway, Sweden, and Denmark. I looked upon what happened in Finland, also a little bit in Iceland, especially Finland. But what I saw was also that, especially media in Norway, that they, I mean, when you compared with other medias, very, very focused upon fear. And also this little dispute between the health authorities in Norway came to the surface after a while. But I mean, that also is part of health. It's a health issue. When Beate now says that parents were afraid to put their kids in school, there is a reason for that. And I wonder then, was there something also in the communication that went wrong and was also harming the health?
I would say there was a kind of open debate in the Norwegian media, and there was voices from all sides, and we had a number of criticism people who were voicing loudly, and I think that was also in a way good for the debate. There were always somebody who wanted to do more. There were always somebody raising their voices, wanted to do less, and we had to find this way in between. And I think the challenge has been to really communicate with certainty when there is such a huge uncertainty in what measures should be taken. And a last point then from my side is that we have also been really stopped in trying to do serious research by ethical committees to try and find out what has been the effect of all these non-pharmaceutical interventions we've pulled on the society. And because of kind of ethics and approval that you have to have a written consent, we haven't been able to evaluate the effects of school closures or closing restaurants and bars, which is also, to me, a very serious ethical issues that we have to work on. And finally, I would also like to say that in Norway, I think it's been good that we have done some of these, we have had these Holden committees that has also worked on the societal sides of the pandemic, not only the medical side. And they've now issued 4 reports that is judging this in a more broad perspective, which I think has been good.
Mika, do you want to add something?
Yeah, I mean, the communication is, of course, very critical in a crisis like this. The big difference to this crisis to looking at 10 years back when we had the H1N1 influenza pandemic is that the whole media sort of field has totally changed. We have all the social media, we have all the regular media is like online, basically. Helsingin Sanomat makes an interview and it's out in 2 minutes. You have a interview on camera, it's streamed, it's on the web, it can be immediately seen. I think this also affects politicians a lot because I can see my politicians, even in government, sitting and reading Twitter all the time in the government negotiations to look at the reactions that come out. And I have to say it probably did affect my minister quite a lot. She was extremely hardline, and she listened to those who were quite hardline. And we had to try to pull back on a couple of times, and a couple of times it did work, and a couple of times it did not work. And the way that they present themselves in the public also affects the mood of people. So we knew quite early on that children are not at particular risk immediately. And we tried to communicate that, but then if you have the media giving the totally different message and sort of, are you sure, are you sure, are you sure? And it's very understandable that people are afraid for the health of their children, but they were also afraid of the children. And we saw this with the teachers. That was very scary, actually, and unfortunate.
We have 3 minutes over here now, but then I just want, I mean, when you hear this, the experts saying it was not dangerous to have your kids in schools and kindergartens, but you felt the pressure from the parents and you moved on that.
We didn't move on that. We moved on the advices we got, and we got clear medical advice that it would be a good thing to close down schools and kindergartens. But of course, in that situation, you have to act on what you know and what guidance you get. And I think one of the problems would be if you feel like I don't know what to do, so I'm doing nothing. And that was important to us during the pandemic. Okay, this is the information we get. This is the advice we get. We need to find some way, and we do it like this. Okay, maybe it's too much, maybe it's too less, but we have to do something. We can't sit here with our hands in our lap.
Thank you so much, and thank you for joining us from Oslo. We will have a break now until 10 to 10, and then we are back again here, and we will talk about in depth about the adolescents, the kids, post-pandemic, also in the pandemic. So thank you so much.
Thanks.
Thank you. Bye-bye.
Nice to have a great panel to talk about one of the things we touched upon in the last session, namely the kids, the youth, what happened to them and for them during COVID. I will present the panelists here. We have Salvor Nordal from Iceland. You are ombudsman for the children on Iceland. And then we have Lukas Virtala, the Union Upper Secondary School students in Finland. Nina Langeland, professor in infectious diseases, University of Bergen, a member of the Corona Commission as well. And Paul Suren. Hi, Paul. Researcher at the Norwegian Institute of Public Health. So welcome to you as well. I'm not sure whether I should look into the camera or on the screen when talking to you, but I'm not sure where you find the best communication here. But since we have a Finn and a person from Iceland here, I think we can start with hearing a little bit about what you did and how the effects of the COVID measures affected kids and the youth. Salvor.
Well, my office, we have been really talking about the importance for Iceland to implement child rights impact assessment, called CRIA. And that means that all authorities, public authorities, should make an assessment when they decide on something, and that for all decisions, that they need to decide, they need to assess what is the impact on children. And in our view, the pandemic has really shown the importance of having this systematic assessment, because I think often decisions were made, but they didn't really think about what is the impact on children. And children are, of course, I mean, being 25% of the population, they are of all kinds, and there are vulnerable groups, and they were really deeply affected. Children with disabilities. We have seen over the years that decline in mental health, and we have a suspicion that it's even worse now. And someone mentioned yesterday that we have seen, for instance, a rise in eating disorders in Norway, and that is the same happening in Iceland. And children with low income from low-income families, children with immigrant background. I mean, all those groups need special consideration and care, and especially if you're restricting the schools. I mean, do they get, and if we are relying more on homeschooling, for instance, do they have equipment? Do they have support? You know, if the family or the parents don't speak Icelandic, I mean, can they really support the children? So I think the children were left behind. I mean, I think they were not taken into consideration, and that is something that we have been highlighting throughout these 2 years.
But what do you think were the main reasons that kids were affected in such a hard way? What do you think the politicians and the policymakers, what were the main reasons?
Well, I mean, the reasons is that, you know, they don't have this, I think it's very important to have the systematic review or assessment, and this goes for, I mean, when you're taking decisions very fast, as for instance in the beginning, then you focus on the main thing, that is to prevent cases, corona cases, but you're not thinking maybe on all the social impact that it may have, and I think this is fairly recent also that we are, and I'm speaking for most ombudsmen. I mean, we are really trying to fight in our countries to have this systematic assessment, so people don't leave children behind. So I think that this is fairly recent for probably in the public decision making.
And Luca, go to you then. You are representative. You represent the youngsters here. And how did you see what happened in front of your eyes and with your fellow persons around you?
It was tough for sure. Me myself, I had just turned 18 once the pandemic started, and you know, I felt like I was missing out on my youth, not being able to do any of the things like some of my older friends had done or anything. But now in hindsight, looking back at it, it wasn't too bad for me myself. I've always been more of a independent learner, so distance school wasn't terrible for me. But then again, if I compare myself to, for example, some of my friends who had moved out at a young age and were living by themselves in their small apartments, it wasn't great for them, since, you know, having to sleep and eat and do school and hang around all in the same small area, it really brought out the loneliness and anxiety issues even more than what they had been before. So it wasn't great for sure.
But have you seen anything? I mean, you're probably talking a lot about that with your friends as well, but also on the national level, is there a discussion about what happened to young people?
Yes, there is, and I feel like what COVID really brought to in general knowledge was that the young people weren't doing too great even before the pandemic, but what the pandemic really just brought out all the issues that the young people were having with their mental health, for example, and also like what Salvor just said, I completely agree with that. It was sort of like how I felt like most of the time was that the children and the young people, they were sort of like the easy group to leave behind, since I personally trust our democracy system, and I really trust that the people that are elected every now and then will do the correct decisions. But then again, they are politicians. They have to gain the votes every now and then, and since the children and the young people aren't allowed to vote, they don't really have to be in favor of them that much.
I think there are two very interesting points here. One is that the COVID actually amplified problems already there, and also the feeling of being left behind as an easy ones. And that is a big sacrifice. I had a Danish young man on stage asking about that, because there is a report done by Nordregio also talking about what happened in the Nordics after post-pandemic. And he said that, yes, we were sacrificed. Do you agree with that?
Yes, in a way, because of course, us the young people also understand that it wasn't possible to keep the schools open the whole time. Like the situation was really bad. Action has had to be taken, but at some points the actions, they didn't seem logical at all. I remember there were times in Finland where the schools were closed, but then again the bars were open. So like myself, who already was overaged but still in school, I didn't have the opportunity to go to my school to study, but then again, if I went to the bar next door, bought a beer, I could study there. So it didn't really make sense at some times.
And this feeling of, because this is, I mean, it's the young generation coming up to vote in the next elections to come, and to not ask this to be a leading answer to it, but what do you think it did to the trust level of youngsters?
It depends on the young people, I feel like, since some of the young people really came out of COVID way better than others. So obviously it will have really big effect, but not too sure yet what the effect is going to be like.
Paul, Hi. We have now, I mean, we've heard two examples from Finland and Iceland on the effect. But you were, since you're working with, as a researcher on kids and health issues, can you tell me, just get us all informed about the discussions that you had and what you actually did during these first months, and then how the thinking developed throughout the years?
Yes, well, we had nationwide school closures during the spring of 2020, and what we learned from that was that we thought it was going to last just a short time, but it took 2 months until all the schools were opened up again. So we didn't want to end up in that type of situation once more. And we soon realized that we needed an infectious disease control system with flexibility so that it could be adapted to the local COVID situation. And that's when we made this traffic light model with the green, yellow, and red level that could be implemented locally. And we also had a very ambitious system for testing, tracing, and quarantine to control infections locally. And from the point of view of controlling the infection, it worked pretty well, I would say. And up until the Delta wave, we didn't have extensive spread of COVID in schools. But it had a lot of unintended consequences in terms of, effects on learning and quality of life, mental health, general well-being for students. And I think what we didn't take into account in the beginning was that you can have pretty severe restrictions for a couple of weeks and it probably won't do that much harm, but when they last for months and most of a school year, then it's very different.
But sorry, continue.
So I think that's like a main point of learning for later crises, is that you always have to think that when you implement restrictions, they will always last much longer than you anticipate.
But then again, you heard Beate Husa, I'm not sure if you heard her talking here, but she said as a politician that she had also a lot of pressure from parents who said that if you don't close the schools, we will still withdraw our kids from the school. We will fear that they get contaminated in schools, and we don't want to allow that. So, I mean, you could also see that there were pressures from the community and the society. So how do you see that when you hear now the effects that it has had on kids?
Well, I understand that they have to take it into account. There was pressure from parents, from staff working in schools and daycares, from the media, from politicians. And there was also academic disagreement about how much spread of infection there really was in schools. So I think it's unavoidable, but it's very important for decision makers, I think, to be able to also resist some of that pressure and to try to keep their heads cool. And the thing about, whenever the rates of infection is rising, then new measures are implemented and people start changing their behaviors, and the testing and tracing systems are kind of put into action. But it always takes a couple of weeks until you see the effects of that, and those are the two critical weeks. Then you have to trust that what you are doing is actually working. And our experience was that ultimately it did always work, but there was an enormous amount of turbulence while we were waiting for that to happen.
But do you think that the well-being of the kids and the youngsters were taken into consideration during these 2 years? It was taken into consideration. For example, this traffic light model, one of the main purposes was that we would ensure that everybody had physical access to their schools every week, that they could at least go to school parts of every week, for example. And this cohort organization would ensure that children could at least socialize
other children within their own class. But some of the unintended consequences were that, for example, this red level became much more strict with a lot of digital teaching than we had anticipated. And this cohort organization, that it sounded kind of cozy to us in the beginning, but there was also it also resulted in social exclusion, because if you were not, if your friends were in another cohort, or if you were not part of a certain group of friends, then you were left out.
I talked to parents during COVID, who felt that it was almost as if the state said it's okay that you bully your neighbor, because you could, for instance, in one street have 6 kids, and one of them was left out. And it was always the one that also had a problem getting friends. And they felt it as if the state said, yeah, it's okay.
Yes, like when we recommended that you shouldn't have, no more than 5 children should socialize at once, it was meant as an advice, and the idea was that you shouldn't invite 20 kids into your house at once. But a lot of people anticipated it, or they interpreted this as being almost like a law, that it was forbidden to have more than 5 kids socializing at once. So that was also another thing that we didn't quite anticipate, that our advice was often interpreted as having almost like legal status.
Yeah. And Nina Langland, you were a researcher at the time, but you've also, you've been writing on this report and evaluating what happened. Is there anything you see differently now in hindsight?
Well, first of all, we've had a mixed impression for children and youngsters, and that's that some did better not being at school. Children who were bullied, they could stay at home. Some concentrated better and had a better learning situation at home. While on the other hand, and I agree, particularly children with non-Norwegian speaking parents were lagging behind. And I think even though the government had the best of intentions, and there were financial allocations for children to catch up, but it still didn't work. I think we were on the issue of children who had non-Norwegian speaking parents. I think the willingness to actually see them and not see the big average, because the big average is not so bad. High school kids got better grades, exam in university and college students, they did what they were supposed to do and they completed their studies. So there were many things on the positive sides. When you make an average, it seems like, well, this wasn't so bad. But it wasn't good for underprivileged children.
But is it only underprivileged? Because when you now see that the numbers rising, girls and boys going to eating disorder, and you have heard about their mental health issues, then one thing is the marks you get in school. But that can cover for a lot of things. Yeah.
I agree with that. And referrals to child psychiatry, for instance, is increasing. It's coming a bit late, though. Yeah. I mean, it's coming a year after the pandemic started. So it's a bit difficult to interpret. Didn't the school or the social system see what was going on? Did it come in too late? And it was also a question of vulnerable children. What does that word mean? I mean, there was no clear definition of who we're talking about.
Exactly. Luca, now you hear kind of the reasoning for how it became. What do you think should have been done differently?
Yeah, I just feel like the young people and children, their voices weren't really heard. Like, I can't really remember that when was I asked that, hey, what would you do? What would you do if you had the power to make the decisions? Like, I quite often felt like that the policymakers, they just thought that what was best for us, the young people, and went with it instead of actually like trying to figure out that, hey, what do the young people actually think about these situations?
Yeah, I agree. I totally agree. And making this assessment means that the authorities should talk to children, and they should think about sort of mitigating measures. And for instance, in the schools, because he was talking about the cohorts and how they split up the groups. The children didn't have anything to say, and at least in the schools I know of in Iceland, children were not consulted because this has had to happen so fast. So they were not really in the decision making. So then they ended up with the best friend being in a different group, and and splitting up all kinds of way. And there is another thing, and this time dimension in this. I mean, we started very early on to collect narratives from children, and that was not a very sort of scientific. It was just they sent us narratives, and to begin with, they were quite positive, and it was okay to not have school for several weeks, and you were more. It was slower. The society was slower, and family was home, and so on. But then it was not over after 3 months, and it just went on and on. And then we later on we got narratives that when they were much more pessimistic and much more difficult. And I think that is one of the big lesson. I mean, we start out with measures that are supposed to be only for several weeks or several months, and then it's over. But then it ends up being for 2 years. And someone mentioned here Philippines, closing schools for 2 years. I mean, they wouldn't have decided that to begin with. Now we're going to close the schools for 2 years. But that is where they end up. And so I think we need to really think about that. And another dimension is, as you mentioned, I mean, the impact on children is a long-term thing. It's going to. We will see the impact in the next years. It's not something that just happened and then now we know.
No, we had the discussion in Norway, for instance, about concerning exams, for instance, for the high school. I mean, some of them haven't been in an ordinary school for a very, very long time.
Exactly.
Even though the marks seems to be okay-ish, then what did it actually mean to their brains and the way of cooperating with others and so on and so forth. But Paul and Nina, since you're both here now, you also ended up in a little bit of a dispute at a point. And I want to bring it up, not to get into this fight on the stage, but I think it's interesting because it's telling about a time where everything is at stake, and the way you think can be. I mean, we can change our opinions after a while. But Nina, I don't know who of you I want to ask to tell the story, but you can probably say a little bit, Nina, because you wrote about, or you were talking about the long COVID and also infectious kids in your research.
Yeah, well, it wouldn't have been a public discussion at all if Nakstad hadn't written about it in his book. I was far beyond thinking about it at that stage. So
and Nakstad is, you all know who Nakstad is.
So to me, we knew our data, and we knew that they were true and definitely published in 2 sessions in very good journals. So it didn't really matter to us, but it has to do with focus on children, and I think we agree on the importance of focus on children.
Can you say a little bit about the research and the numbers and what it was about?
Yeah. So what surprised us, and not only us, is there anyone here from the Faroe Islands? Because they had actually published the same as us a bit earlier, and that is that we found when we screened everyone who'd been in a family where there was one infection. Then we screened the rest of the family for seroconversion. No antibodies at time 0, and then we saw who seroconverted. And then we saw that children who were tested and tested negative by these PCR tests, they seroconverted. So our interpretation is that they probably had lower virus, but they got infected just as easily. And you know, now with Delta, also Alpha, Delta, and Omicron, nobody doubts the role of children in keeping infections going. So
And
I think this is too old a discussion, really, because now
it's not,
clear.
because the reason. No, the reason why I bring it up is, of course, because when what you put on the table also informs the politicians, and the politician move to make actions, and then what kind of effect does that have on the kids? And Paul, you were a little bit on another road here, and can you talk about, to bring it into this today, because we're not going back in time, but why was it that you reacted on this?
It was because there were activists who were using the results in a way that I think the researchers had not intended for them to be used, that they advocated for closing schools based upon it. You know, this was a study of the spread of COVID within families, but the spread of COVID within schools is a different matter. And our data showed, once we had this surveillance system set up, that most children who went to school with COVID did not infect others, and to the extent that they did, most of the outbreaks were small. The average size was around 5. So our evaluation of that was that it wasn't that dangerous to keep schools open, and our concern was that our policies and advice regarding schools had to be based on data from the schools, and the spread of infections that was happening within schools. That was what was behind it.
So the reason to bring it up now is also because sometimes research, it plays a role in a much, normally researchers can write in papers or in medical journals, but no one picks it up being in charge of policy making. This was exactly where you, as a young person then, you were in this crossfire on information. Do you think that mattered to youngsters?
Yeah,
That
for sure.
So much information came in.
For sure it did. It really was every now and then kind of like difficult to actually know that where we are as a society, since you read all of those news over there, but then if you open Twitter, you have all those people telling their opinions, and it was really difficult every now and then to actually figure out that what's going on.
Salvar, what do you think should be kind of then the role of, it's a time of crisis, news media should write whatever we get in, but then you have so many different needs. If you're going to jump into this, but this is just a picture of how it can be then. Yeah.
Well, there was mentioned earlier also that parents were afraid, teachers were afraid, and then we got the information that children were not infecting adults, and so there was a lot of information going on, and that I totally sympathize with that. We didn't know in what situation we were, and better knowledge kept coming in, but it was difficult often to sort of sort things out or know what was right and what was not. And even from the scientific community, it was getting different views.
Right. I think this extends into the discussion in Norway anyway, of whether to prioritize teachers for vaccination, and even to whether or not to recommend vaccination of kids. It has to do with a focus of of teaching, schools, and learning. Because a lot of the absence from school in Norway after the closures in the spring of 2020 has been ill children, ill teachers, too few to do proper homeschooling digitally. So there are so many things that is affected if you really want to focus on kids.
Yeah. But just a small round here before a break again. No, it's not a break. We will bring up the people who were here yesterday as well to a question time. But what have we learned? Paul, starting with you.
Yes, like I said previously, we learned that all restrictions, you have to plan for them to last for months and maybe even a whole year and not just weeks, because that's what always happens. Another thing that I hope we'll be able to do more of during a future crisis is to do systematic evaluations of restrictions. Like in Norway too, if we had been able to systematically compare different levels of this traffic light model, we might have been able to avoid the most harsh restrictions in many places. And we would have liked to try out different types of testing and quarantine regimes, for example. That was also not possible. So it's important that we create a climate where those types of systematic evaluations become acceptable to the public.
I had Anders Tegnell and Camilla Stoltenberg on stage last summer in Arendalsuka. And of course, I asked Anders Tegnell, now you see the numbers, kind of Norway won. What do you say about it? And then he said very firmly, but we don't know what actually helped in Norway. We know something helped, but we don't know what it was. There was 50 measures, perhaps 30 were enough, or we don't know. That's what he said. Do you understand him?
Yes, and I think he's right. We know that the overall outcome was successful in terms of keeping the number of deaths and the amount of illness down. But there are still a lot of restrictions where we don't know whether they actually work or not, or whether they are necessary or not. So that is a big frustration. I think that we didn't use the opportunity well enough this time to learn more about that.
What do you think that we learned?
I think from the 2 years as a scientist, I would say what we've learned is the unpredictability. We cannot predict what comes next. When after Alpha, we thought it would be a variant of Alpha, then came Delta, which was not. Then we thought the next one would be a variant of Delta. Omicron definitely isn't. So what comes this autumn? I'm sitting in an expert group for the EU Commission, and planning which vaccines to choose and what are the big vaccine producer going to make which vaccine. Is it a combined vaccine? Is it Omicron? Probably not. And I think it's the unpredictability that we've learned.
And what about the younger generations? Do you think we would do something differently?
I think we will know more about vaccine efficacy and safety in children.
Luca?
In my point of view, I feel like we've learned to, in a way, not leave anyone behind. And what I mean by that is to actually listen to everyone, including the young people, since, they are the ones who know the effects best, since they are at the very point of the action.
And Salvar?
Yeah, I agree. I think we need to consult the children much more, and we need to think about mitigating measures for vulnerable children. And lots of what has already been said is I agree with. And of course it's unpredictable, but I think we can predict it's going to be long the next time. So it's then we need to take decisions that take that into account.
Because, I mean, the question is one thing is not to die, but another thing is what is happening when you can't live.
Exactly. And you need to think also about we have been successful so far, but what is going to happen in the next years? How are we going to see the young people coming out of this? because it takes time to really know how they have been affected.
Thank you so much, and thank you, Paul, for joining in here on screen. I stopped now because I want us all to be able to get coffee and to raise up and talk a little bit, but then back here in 5 minutes. And what we're going to try then, I'm not sure how many I'm not totally 100% sure who will be on stage, but what we want to do is bring the people who've been on stage up here again, all of you, and then the people who are left here who were on stage yesterday. And since this room is fairly small, we can also open up and to use this opportunity to have a question time, as in the Parliament. And then it's lunch. Is that okay? Good. Thank you so much.
Thank you.
Thank you.
And now also, I think I want to actually create this into another sort of presenting ourselves. I will be in the middle, because now we're now going to have a real question time. So that means that the people asking questions will be here. So that means that 3 of you who were here yesterday, and you have to tell me your names, because I was not there yesterday. I was in Oslo. So if you can stand over here, so we will get these, and you can use my table here, and like this, if you want to. So now we have this format where we can ask each other questions.
Okay.
Do you recognize it now?
Yeah.
Because, so, and please tell me your names, and you can say a sentence of what you were talking about yesterday and where you're from. And since Nina will leave at 11, Nina will leave at 11, so all the questions will have to be to her in the beginning. So we take one and one here. So we can ask, so you can start telling your name. And
my name is Vilhjálmur, same as Wilhelm in Norwegian. Vilhjálmur Arnason. I'm a professor of philosophy and chair of the Center for Ethics at the University of Iceland.
Yeah.
My name is Göran Kolstad. I'm Professor Emeritus of Applied Ethics and also member of the Swedish National Committee on Medical Ethics. Yeah. And I talked about vaccination and global justice yesterday.
Hi, my name is Katarina Okaher. I'm an Associate Professor of Law at the University of Copenhagen, and I was discussing health and human rights.
Yeah. So here you have the ethicists standing. Now we've had a long talk about what happened to a specific group during the pandemics. We can all start thinking about the questions to Nina, using her competencies while she's here. William, do
right? Yeah. Well, I think I took down a question that that Nina posed, and I would like her to perhaps reflect on that question, because I think you just mentioned it. You said that who are vulnerable? I think that's a very interesting question, because we have used the notion of vulnerability quite a lot, and perhaps I think if there is one major lesson that has been going as a red thread throughout our discussions, almost all the speakers mentioned it, and the policymakers have also alluded to it and mentioned it explicitly, that we need to be more attentive to the vulnerable groups. And of course, children, you said that some had done better actually, while then there were also that it came out more clearly who were more disadvantaged. But nevertheless, you asked, who are the vulnerable? And perhaps I would like to ask, why did you ask, and what is your opinion on vulnerability in this context?
Yeah, the reason I asked was that as the Norwegian Corona Commission, as we looked into this, and then we asked for definitions, and the Ministry of Education and Health, they made a group who were to follow the pandemic, particularly for children in schools and kindergartens. And they found that there isn't a clear definition. And then there were examples of children who were defined as vulnerable, but they didn't want to be seen as vulnerable, and their parents, so they didn't come to school anyway. And then, of course, it was the ones who weren't discovered. Children from violent homes, nobody knew about it. Teachers are often the ones who can say, hey, is there something wrong? And they weren't identified. And I think this may also be related to the increase 1 year later in referrals to child psychiatry evaluations. So it's a bit sad, and I don't think there is a clear definition. Maybe if you ask the kids themselves, they might be able to tell you, but this was related to your discussion of why didn't anyone ask?
No.
Happy with the answer? Anyone want to?
Yeah, it's a very
yeah.
interesting answer. Sometimes I wonder, do we overestimate the importance of definitions? I mean, or do we just know a vulnerable person when we know her situation? But I can see perhaps that we need some kind of frame of reference when we are working as policymakers about mitigating policies or something like that. We need to know who they are, but at least a definition should not stop us in, or lack of a definition should not stop us.
Anyone else wanting to comment on that?
Well, I think this is a very important question, and it doesn't have an easy answer. And of course, the most obvious sort of categories come into mind as the ones I mentioned. But in my role as an ombudsman for children is to try to recognize different groups. One group, for instance, that has probably not been thought much about is children that are caretakers at home, have a long time or there's a long time illness of the parents, and they are really taking care. And I have been in debate on a Nordic level on how can we reach this group, which is very invisible. So there are lots of different groups, subgroups, that we need to think about.
I just want to add a story from what I heard. A friend of mine is working as an immigration, or she is a what is it called? Minority counselor at a high school. She found out that lots of the girls in her class, they had contraception in the school because they were not allowed to have contraception pills at home. When they were not allowed to go to school, what happened? They became pregnant. So that is a kind of a vulnerability that is not very easy to point towards, perhaps. Anyone else? Any of you guys wanting to say something, add something to the concept of the vulnerability?
Well, I have a question which is really related to that, because in your presentation, Nina, you said that teachers should have been vaccinated early, and this is, of course, a very important ethical question which the pandemic raised. I talked about yesterday about the vaccination priorities when it comes to rich countries and poor countries, but also within our countries, these have been discussed. We have, at least in Sweden, I think we practice the very well-established priority platform saying that health care should be given according to needs. That's the only principle really could just direct the priorities, and also follow that with vaccines according to needs, and starting with the most fragile elderly, some people with different kind of handicaps and so on would also be included in this, and then going lower down in the ages. Healthcare personnel, as I remember, not only those who have worked with the elderly. But you suggest another kind of priorities, which is not less on justice, but more on utilities. So I would like to have that question clarified.
First, before vaccination was initiated in Norway, there was a group looking at the ethics of it. Ole Fridtjof Norheim, has he been here? No. Okay. But anyhow, so they concluded that anyone with increased risk of mortality should be prioritized. And that kind of excluded healthcare workers. And WHO have said that healthcare workers should be prioritized. So this was how the discussion started, and it was elderly, people with comorbidity, and healthcare workers to take care of them. That was decided on. So what we did in the Commission was not suggesting teachers, but we were pointing at it, that if you really want to prioritize and protect children, the discussion of teachers should maybe have come up earlier than it did. And this was the summer of 2021, so there wasn't a lack of vaccines in this country. It was a question of who to prioritize. Now, whether it would have helped or not, because at this time it was quite clear that COVID spread among children, so they didn't need their teacher. But maybe if teachers could be more present, it wouldn't be so much homeschooling, and that may have protected vulnerable, whoever they are, children. So that was an argument. If you want to protect children, also protect their teachers. Just like if you want to protect old and vulnerable patients, protect the healthcare workers. It's kind of the same thinking. So I think it should be discussed if one wants to really prioritize children.
Want to follow up, or?
Well, I see that's, of course, a different way of looking at the priority question than is the established based on kind of justice and needs, so to say, and there should be other criteria here that should come in. And but this was what you said was when the fragile elderly was already vaccinated, so that would be the next grouping, so to say. And and so we follow more the kind of age grouping from the top down to the younger. But then there should be some other ways to think here also, as you suggest. Yeah, that's an interesting comment. Thank you.
May I add to the vulnerability question that I feel like one major problem regarding the question is that if a person is in a vulnerable position for, let's say, because of another illness or because they are part of a minority group, the vulnerability is often seen as such a weakness that you should be ashamed of it, which obviously then makes it way more difficult for the person to actually seek for help or even, like say that, hey, I would actually really need the vaccination, for example, or whatever. And it obviously is a difficult decision for the person to, make the step because they might be afraid of that, oh, will the other ones see me as more weak than them, for example.
Yeah. Want to respond on that?
Well, that's a very interesting point. You mean that it can be stigmatized to stigmatizing, and then I guess one way around that perhaps is to that it's a working sort of category on behalf of professionals, but not something that is used in discourse with the people, with the relevant people, possibly.
What we are discussing now, I think, is how to build in. There's a kind of new term in the ethics discussion called designing in ethics. How can we usually look at ethics that we make some decisions, we should make the decision to prioritize that group or that group. But the designing in ethics within institutions says that lets us create institutions like schools, like healthcare, that in the practice of the work, realize the ethical values that will, and we have to find then how should we organize, structure these institutions so that these people that we are talking now, those who have the most need, one can say, the real vulnerable, are identified, dare to, as you say, come up, speak for themselves, or at least you mentioned also, I think, early on, there should be some kind of communicative fora here that could develop as a result of it, which could be, that's, in my view, the lines of thinking we should, from the ethical point of view, think about.
And this is also aligned with what you were talking about, the assessment or what you're going to do on Iceland now, to create this group of thinking.
And maybe it's we should not talk about vulnerable. Maybe those in need of certain help. In for instance, families are different. In some cases, people live in spacious houses. Others are in small in some cases, both parents work at home and another they're working somewhere else. I mean, and it's not vulnerable, but it's just that they are fighting over the computers at home, or the desks, or So it's the need can be in all kinds of forms, and then you just have to talk to the children and see, do you need more? Do you need equipment? Do you need this? No, what is the need? And do you need maybe to be able to come to school just on your own to do your homework, or
I remember, I mean, it's perspective as well, and I remember very early on when everything was closed down and we should be with our families, and there was a television ad where you could grill a marshmallow into your stove. I mean, it's like sitting there with a family, big round surrounding that. And then a friend of mine who lives in a very small apartment in Oslo, she's from Somalia, she said, yes, what? Guess here, this is not our lives. So it's like where you sit, you also see what it's around you, because there are a lot of people who do not have a garden and somewhere to grill your marshmallow. So, going to Denmark and to the law, do you have a question for Nina?
I mean, I think what's been really valuable in the discussion is that you've really all focused on the individuality of the experience. And I think that's important, and is sort of overlooked, that people can have similar, on the face of it, similar circumstances, but their experience can be very individual based on different issues. But I mean, to kind of switch to a more legal issue, I mean, I thought that today, and maybe even yesterday, there was this kind of idea of Sweden on the outside and then this shared Nordic approach. But I kind of want to question that a bit, because, I mean, as we heard earlier, in Norway, and I believe in some parts of Finland at least, you had a much more strict approach from a legal perspective. At least in some stages, that people weren't supposed to actually meet, and that you could be penalized for coming in contact with people who weren't within a certain, beyond a certain number. And that's very different from the approach in Denmark. That was never the approach. And actually, quite early on, for the first few weeks when the children were all sent home, in Denmark, the health authority said that older people shouldn't meet with children, and there was a discussion on whether children should play with their friends. And then quite quickly there was this kind of decision that, okay, well, it's actually good for people to see each other and good for children to play and good for older people to see their grandchildren. So I was just wondering about the Norwegian approach and kind of why, why this more strict approach was actually adopted.
There's been a lot of discussion about it in this country, and one of the things is that the national authorities gave one level of restrictions at school, and then municipalities could have more strict. They couldn't ease it up, but they could have a more strict, there's definitely been legal discussions about this in Norway, and the constitution has come much more up to me than I thought it ever would as a medical doctor. So it's the health laws have been used by the municipalities, and it's been questioned on later on. So that has to do with giving people fines if you had a party at your home with 2 more people than you were allowed. And the police said, are we going to do this job? And then there was this, we weren't allowed to go to your cabins in the mountains. Now, this is important for Norwegians. I don't know if anyone else can understand it, but but it was forbidden. The faculties of law in Oslo, in particular, said, "But this is unconstitutional." So questions have come up, But I really can't remember. Now I'm looking at you, Hilde. Has there been any, this has been taken to court? I think it has in a few
but
instances.
she was turned down. I mean, we had Beate Husa here, and she was accused of being over-ignited. Because we also had a couple of professors at law school here who really opposed what happened, because there were some very trigger-happy politicians for a period of time. And I've also heard stories about Danish police trying to throw people out from parties, and they were met with, "But you're not allowed to." So there were differences there. Do you want to follow up?
I know about the debates, and I think yesterday there was sort of a discussion about how bioethicists hadn't been, to the fore in these discussions in the way that I think lawyers have, in Norway at least. So do you have any idea why that is, or it's just coincidence?
No, I don't. What I mentioned earlier on, which I just recently discovered, was that the restrictions which were it was new legislation. Now I'm not used to discussing law in English, but then I just recently discovered that in the Faroe Islands, everything was only recommendations. It was not a law given for this or that. And I've read science about it then, of course. And then, people followed the recommendations just as good as Norwegians followed the laws. So it wasn't necessary with the law.
But they are very Christian in Faroe Islands, so they know that God tells you what to do, and they do.
I'm not so sure. I think, they may be Christian, but I still think it's very interesting to see that people follow recommendations, they follow authorities. It's not necessary with legal
Well, I think that this is also goes to Sweden. Sweden is not a very Christian country, but still, the huge difference that we have been that we heard about, I think that's a little overestimated. I think for that reason that you say now, that in Sweden the restrictions were followed. We didn't have so much legal regulations, and perhaps we can remember, for example, what Confucius said, that if you have norms coming from your inside, they are much more will be followed much more than if they come from outside as legal law. So if we can get that kind of ethics from within, so to say, the population. And let me also add to this, because it's also have to do with this kind of designing in ethics idea in institutions, that how can we get these people working in these institutions more also thinking in ethical terms. I mean, we as ethicists have a big job to do that there, I think. An example which illustrates that in the elderly care in Sweden during one period, I don't know exactly how long, 85% of those who died alone without any relative near.
Yeah.
And that says something about lack of ethical sensitivity among people who have to make this decision. And one case where the children couldn't come to the place where their relative or their mother or father died, but after she or he had died, they were invited to get things out because they needed a new person in this room. I mean, for that reason, they were welcome, but they were not welcome there to say goodbye to their dear father or mother. So I think that's the way to increase this ethical sensitivity in these kind of institutions.
You have to go, Nina, so I look at you now, and even though we will continue, thank you so much for joining in on the discussion here as well. Thank you. Bye.
I have a comment that relates to what we were discussing, because Paul Soren had said, I think that Well, one of the problems were that advice was often interpreted as legal. So, but then it sounded to me that as if there had been legal restrictions, but he said that actually they should have been, they were meant to be more flexible. And I think I could say, like in Iceland, I think we are generally not very compliant people, but we're very compliant in COVID, and that's partly because we were so lucky with the experts, with the Troika that were in the forefront. And I think there was a brilliant person there who always spoke, sort of appealed to us as, use your own judgment. You know, we're all in this together. This is not a matter of us sort of thrusting anything upon you. You should understand this and just behave sensibly. That's, you know.
Can I bring in another? I mean, no one of you talks about it here, but for a person who was not, I mean, I was not either a health authority or in organizations working on it, but what we felt also, I mean, as an average citizen, it's also this concept of shame. Because not to be kind of private here, but love in the time of COVID, for instance, it didn't mean anything to have, as I do, have a boyfriend abroad. We're told that you are not married. If you were married, you could come to Norway, but if you're not married, you cannot come to Norway. I mean, the virus do not care. It doesn't care about whether you're married or not, I would guess. But then this thing that if you didn't follow up, if you were not compliant, then you got the finger poked at you. Very much. So is that also, I mean, we have it in the Nordics. I talked about the Christianity here, but there is some certain sense of shame here still.
Well, there was a lot of social pressure in Iceland. I mean, we were sort of all in it together, and then people were pointing out at someone who were not following the rules. So, and that is both positive and negative, of course. When people are just reporting, you know, this one should be in quarantine, and this one should be, you know. So it's. But I think they sort of use sort of soft measurements, sort of to try to get that. But coming to this, what you were mentioning about love is for instance, for children with 2 homes, and even with the other parent in another country, and then they didn't see each other for months and months. And even in some, that was not the case in Iceland, because you could travel around, you could go to your summer house and you could go to different parts of the country. But we have seen many issues from other countries where you're not supposed to travel, and the kid was at one home when the law was issued or the measures were taken, and then it was stuck there in a way that they couldn't visit the other parent, and that is a big issue.
Luca.
Yeah, actually, feel like me myself, I'm from Helsinki. I used to live with my parents, but many of my friends had moved to Helsinki to study in the high school, the same as I did, from the countryside. And then I remember it was about 2 years ago when the situation was, it was like way worse in Helsinki and the areas around that than it was outside of that region. So then the whole region got basically shut down, that you weren't able to leave it or enter it unless you had like a good reason that you could prove to the authorities at the border. So also, you know, like the people whose actual home, whose parents were living somewhere in the countryside, they weren't able to go there since, you know, like they weren't allowed.
Yeah.
I think this goes to a very fundamental question about representation in policy making, and with anything, you know, to do with bioethics. There has always been a problem that some people are making laws or policies who come from, you know, let's say this sort of what they think is a standard, and then people who fall outside this, you know, it can be gay people, it can be all sorts of groups. They've always been, you know, discriminated or treated worse because, well, there's just not an awareness of the importance or their experience. And I think the more intimate regulation becomes, And the more people it affects, which has been the experience of the pandemic, that there's always been these intimate regulations and who can, have children, get married. But now they just affected everyone. And then you could mention the concept of vulnerability again. And I mean, I'm also an immigrant, and I had a very different experience from many of my Danish friends because, and they weren't, a lot of people weren't aware of that, of, well, for immigrants, many of us were very alone. We couldn't travel. I'm from an island, so we couldn't travel to our homes for some of us for a year. And I mean, that just wasn't, Denmark closed the border at the very start. It was sort of one of the first. And I think the law and the policy, it took quite a while, but then it kind of developed because there slowly, by the summer at least, was a recognition of there's many different types of family. And then if you had been in Denmark, then there was what was called, I mean, it's kæreste in Danish, but they translated it to sweetheart, which I thought was very funny.
Kæreste.
Yeah. And
Kæreste.
And then you could, if you were a sweetheart, you could visit.
In Norway, only marriage is counting, you could say. So we can talk about why we ended there. But can we start now asking questions to Luca? And I will. Did you want to add something?
No,
perhaps
no.
We start the other way around this time. And if you have a question for Luca.
How do you, I mean, it's a big question, but how do you feel that this has impacted the sort of the choices that your, fellow students are making now in terms of what to do next? I mean, did you have other plans maybe? Has it changed?
For me, it didn't change basically at all, but for some of my friends, yeah, for sure it did. Like, for example, maybe the biggest difference was with the people who were thinking about going to study abroad, and then basically it just got so difficult, especially for the ones who graduated 2 years or 1 year ago, and they were supposed to leave like last summer or 2 summers ago, and it got really difficult, and then they just decided to stay in Finland and maybe like do some other studies abroad later on. But yeah, for sure, for some people it changed a lot.
Do you have a question for Luca?
Well, I have a question. Yeah, well, to Luca. No, for Salvar.
Yeah, Salvar. Yeah, okay. We can because you are still both of you will be here,
yes,
so
right.
we don't need
Ombudsman for Children. Can you notice any measurable changes among children's welfare from the period before and to the period after? Are there indications that this has been a problematic period for small children?
I think one of the issue that we have is that we don't have enough and good enough data to sort of monitor different groups. So, but there are some studies done regularly, and they are showing all kinds of negative. But of course, as she was saying earlier, I mean, there are also positive things. I mean, some children were doing better, and it served them better to be online or at least sort of partly. So, but I think this is now we are in the period to really start to study really what the impact has been, and yeah. So, but I think I can say that there is a growing awareness of children now, because there has been a lot of discussion about schools and all kinds of things, vaccination of children, and there's been a lot of difficult issues debated in Iceland, and so I think there is a growing awareness that we really need to take more sort of more steps towards assessing their needs.
Comments?
Well,
you have a question?
Yeah, I have a question. I think they both mentioned and Mika mentioned specifically Lucas. Sorry, Mika was there earlier. We have to listen to their own voices, and And I think this is actually another sort of red thread that we have had in this seminar. And I've been thinking about the great comment by Kant, or where he says that except for young children and people without the capacity of making up their own mind, we cannot do anyone good without knowing their own conception of happiness. And I think this relates to that. And also what we said about vulnerability, that you pointed out that it can be stigmatizing. So we need to perhaps have one's own conception of the situation. So I would just like to ask you, do you have any suggestions about how do we take this lesson and somehow implement? How can we learn from this systematically, and how should we go about hearing the voices of the young?
That's obviously a really difficult question. It's such a broad topic, but I feel like we have to go back to the basics, all the way back to the the preschool teaching and that, and over there have the teachers talk about these issues when the children are at young age, so that they would seem normal once they grow up, and in that way make it more about their everyday lives and not something really special that only some people have, since I feel like the issues are really affecting lots of people, but they are just too afraid to talk about them.
Do you want to add something as an
I
ombudsman?
agree. This is a difficult question about how. But I think that is a very good suggestion, and I think that we need to. There needs to be, as has been discussed here in both today and yesterday, we need to have just broader view on things. We're not just of course, when we are detecting one disease, we are focusing on that, but there has to be a platform for all these different perspectives. And different groups and different, So that was lacking, and I think we need to find ways to sort of listen and hear from different.
A more holistic view upon the disease.
Yeah, because this is so much about the society. It's about sensitivity. He was mentioning sensitivity, towards the dying and to the loved ones, and just this personal relationship that you can really be near people and or your loved ones, and this is very important. And we saw that for instance from the children that sent us narratives. They were talking about the difficulties with not being able to visit their grandparents and being sort of possibly contagious and the dangers to your grandparents, and so they were really scared about that, and that affects their relationship.
I was wondering if we could learn, or do you think, Salvor, for example, that we could learn from possibly using deliberative exercises, some sort of mini publics, that kind of methodology?
That would be definitely something that could feed into the debate, and absolutely.
I will open the floor if anyone wants to come up, grab the mic over back there, and come up here and ask questions. Anyone want to? We are now so few that we can kind of use this as a thinking platform.
Think tank.
A think tank, live think tank. Yes, there is one there. And come up here so that people on film can also see you and present yourself. Yeah.
Thank you very much. My name is Sigurður Kristinsson, and I'm on the NCBio that organized this meeting. And I just thank you all for this great participation and great comments. I just wanted to use the opportunity to ask you, because there's been a lot of discussion now about the groups that somehow, with the benefit of hindsight, were left out in one way or another, or some of the consequences of these measures were unforeseen, and we see them now, and we're going to see them even more with more research and more information coming in down the line. So, but at this point in time, right now, not after COVID, but after a fair bit of COVID anyway, is there anything that you can pinpoint or would like to mention specifically that you would, with the benefit of hindsight, if you could just roll back time and then be on the left or right shoulder of the people really making the decisions, remind them of, tell them that they did not take into account to prevent something that you would regard as having been a mistake. It's a, anyway, leave it there.
Thank you for this question.
I can have it here, so yeah. Thank you.
Well, I think the
No, you can start.
Yeah, I think, for instance, when there was closing or making restrictions at school, they should have talked to the children and having them with them to make the decide on groups, on days, on facilities and everything. And I think that they would have done much better if they and sort of prevented some difficulties for children in that sense. Regarding vulnerable groups, I mean, we know of already, and we knew before that there were vulnerable groups that have been more affected now than before. So we should have thought about them more carefully. And for instance, children with disabilities and many, for instance, autism, you know, that they have very difficulties with this disruptive program, all the time changing, and you know, it is very difficult for them. And if we just had sort of thought about this, and this is something that was known before, so we could have done better in that. And so I think that we could have, and but of course, I mean, knowing that this was something that needed to be done fast, and therefore I hope now that once we know that we are more in practice, because we have to, as we know that if we have been thinking of ethics, you know, ethics doesn't come naturally. I mean, this is something that people have to learn to sort of think about. I mean, this is something that we need to think about. It's not something that necessarily comes, and it's about, and same with these different groups of children. I mean, we have to just make it as a sort of systematic way of thinking about things.
Yeah, I fully agree with you, especially with the school part. And one thing I would like to also point out that was and still is very, very crucial to the well-being of the young people, which is their hobbies. Like, for example, I'm not too sure about the other countries, but in Finland at least, it was restricted that you weren't allowed to have practices with your ice hockey or football team or whatever, and that really obviously affected also the physical health. But for many people, it was like a great time to not think about anything else except for the sport, so it obviously also affected their mental health in that way.
And exactly, the recreation, I mean, I want to sort of, you know, ask this question, you know, how can we see it in the data, whether children are not, you know, as much practicing all kinds of sports or music or whatever, because, you know, they just dropped out for such a long time.
More questions here? It's, I mean, we have been talking and talking. There are so many issues to bring up. Do you have any concluding remarks from this side of the room?
May I have just because you mentioned, Salvar, one of your main lesson would be to have this child rights systematic impact assessment. Are there any precedents for that? Are these being done?
Absolutely, yeah. And in some Nordic countries, it has been implemented more thoroughly than in Iceland. Okay. So this is something that is being sort of done on a European level, some more than others.
Well, if I have a concluding remark, I missed having not the, you know, I had quite a few questions to the previous group that there was very interesting discussion about the interplay between experts and politicians. And I think perhaps in Iceland, for example, where we had, of course, we were a very trusting society, and then we had an economic collapse and trust plummeted. And I think it was remarkable to see that because the politicians sort of stepped back and gave the stage to a very good group of experts. I think we were very fortunate. And now I remember the word that I was looking for yesterday. They not only had sort of epistemic trust, but also recommendation trust. That's another category, which has to do with more personal characteristics of those who, and then people became, trust was very high. Which is quite amazing, and I think there was an interesting interplay between experts and politicians. It was criticized that perhaps the politicians gave too much the states to the experts, but I guess this cannot be generalized. Perhaps this has to be, according to situation in each country. And I think it's more fortunate in Iceland. And so even though I think one of the commentators this morning said that it was good that politicians were in the forefront, and one worded it very, very well, that expert advice needs to be translated into action by politicians. I think that's a good way of putting it.
That's similar to lesson, I think, from Sweden, a discussion going on in Sweden, that the Corona Commission criticized the government that they were giving too much influence to the Folkhälsomyndigheten, the public health authority, that was in fact directing very much of what's happened. But then that has been a question from constitutional reasons, because there should be a separation between politics and authorities in the Swedish, according to Swedish constitution. But more important, I think, is that if you have a government and you have appointed a public health authority, who are you as a politician to question these kind of recommendations that come out from your expert authority? I mean, that's kind of a strange critique in my view. But to your question about lessons learned, and it's of course, in hindsight we can learn a lot. In hindsight we can be very critical. But remember the time when this appeared, how unsure we were, and the experts on everything. I mean, and so it was like trying to walk in the night and find the best way out of this. For the Swedish situation, I don't know if that also counts for other Nordic countries. I think the robustness of the elderly care have to be strengthened. The marketization of health care, that you have deliver on demand. There were no resources of very important, crucial equipments at the time of the start. These have to be changed, and I hope this will be that we don't just forget about these problems, because that's also a problem. I think that this lays behind us now, and now we go forward as everything is the same as before. That's a great risk, I think.
Yeah. You get the final remark here.
Well, I agree with you. It definitely, in my work, I've really started focusing on older people's rights for various reasons. But I mean, one of them is that they are very forgotten in the healthcare system. In the legal system also, you have still very archaic rules, guardianship systems that are hundreds of years old, where you can strip people of their legal rights. And so, yeah, I just think that needs to be a focus going forward. Older people, but also intersectionality. Older people with disabilities, older people living at home, older people living in care homes, because there's no one single definition.
Thank you so much. Thanks for great questions and for great answers. And I hope that this can live further on in the discussions in the Nordics between all the stakeholders, policymakers and politicians, and us all as citizens. So thank you very much. It was insightful last ending session of this conference. Thank you.
Thank you. Thank you.
And now it's up to you, I think, to wrap it all up.
Well, I won't keep everyone, but thanks so much to all our speakers who are here today and have spoken earlier, who are not here, and all the speakers yesterday, and to everyone who has attended. I hope that there has been some lessons learned, and perhaps we come into the next crisis a little bit more ethically prepared and a bit more attentive to vulnerable issues. Then, of course, I want to close this session again on behalf of the Nordic Bioethics Committee but this is the last day and the last few minutes of this conference, but of course we have another one coming up in September, and the 22nd and the 23rd of September, when we look on bioethical issues related to climate change. And so the ethical aspects of public health on climate change, also with a Nordic viewpoint, especially related to Arctic concerns with climate change and health aspects, and a more global perspective that I think will be very interesting, and that is in Umeå. So I hope that all of you will attend, and many more as well. So thanks, everyone, and a big round of applause for all our speakers, and of course, our lovely moderator, Hilde, as well, who's done a marvelous job. And
thank you.
Truls, who's not here, who organized and put together and was chairing the working group. So with that, yes, I think we should.